S2 introducing description and demonstration. For your OSCE, your examined 30-minute role play begins once you're both seated. Therefore, my description and demonstration of S2 introducing will only be from that point. We'll talk about getting your patient from the corridor to their chair in your workshop. In the introduction for S2 introducing, you need to do 3 things at least. 1, check out the patient's understanding of why they're here and what they will be doing. 2nd, deal with the issue of confidentiality stroke risk of harm to others. 3rd and finally, seek and gain consent for the intervention which is following, i.e. the clinical interview. We do that in a way that is part of the therapeutic experience on the part of the patient. We do it in a conversational way. My voice will be slightly heightened for the purposes of the audio for the video. You'll have to imagine there's a patient here. The patient is John, the civil servant, case study C. I wonder, John, has anybody explained what it is that we do here? That's good. Well, as you know, we'll be with the rest of the team of professionals with whom we'll be working, putting our heads together in terms of how best we might be able to help you in terms of going forward with the issues that you have that are concerning yourself at the moment. Does that sound like something that might be useful for you? Excellent. Before we carry on then, can I just check out, is there anything at all that I've not answered that's on your mind at the moment? Great, well in that case, I wonder if we could start by obviously you'll have to fill in the gaps, which we'll be doing anyway in your workshop, but essentially I did a number of things there. One was in a form of words which was relatively natural to myself. I tried to gauge John's knowledge of what it was that he was letting himself in for, why he was here. I don't ask, John, do you know why you're here? Think about that in terms of building rapport and the therapeutic interpersonal relationship. I asked John not whether he knows whether he's here or not, but whether anybody had bothered to explain what it was that he was letting himself in for, i.e. the onus is on others, the onus is not on him. He's not being tested. I'm not trying to make him feel stupid. Small words, big difference. I then check out with him in terms of making sure he's aware of the confidentiality risk issue. I don't sit there and say, in a way that would disrupt the flow of the conversation. And John, before I carry on, I need to let you know that anything you say that poses a potential risk to any other person outside this room will be taken outside of this room and reported to the appropriate people. You're not a policeman reading somebody their rights. However, I've clearly told John, when I explained that the rest of the team with whom we'll be working will be putting our heads together in terms of what we've discussed, that nothing stays in this room, nothing stays just between the two of us. I've dealt with the confidentiality stroke risk of harm to others issue, but in a way that is conversational and hopefully actually experienced as quite supportive for John, in terms of him thinking that there's lots of us here to help, etc. I also then dealt with the consent issue, and again, in a way that was consistent with the flow of the conversation and in a conversational way. I didn't suddenly, in a disruptive way, say, thanks John, before we carry on, what I need to do is to get you to sign this consent form, please, that we can continue. You get the idea? If your service does use any kind of written consent forms, then that should have been sent out before the person turned up at the service, or it should have been completed at reception before the person came down. It's not part of the interview and the creation of the therapeutic interpersonal relationship, which is what we're focusing on as an important part of our work. What I did in terms of getting the consent to carry on was to quite simply ask, is there anything that I've not answered that I could possibly for you in terms of at the moment? Soon as John says, no, I'm fine Simon, thank you, that's giving me permission to continue. He's consenting to carry on with the intervention. Thank you.